Have you ever heard the term parental alienation and immediately dismissed it as fake psychology? It's a common reaction, and honestly, it's understandable. The controversy around this topic has created a lot of confusion. Today, we're going to cut through that noise. I want to talk about what parental alienation is, what it isn't, and why understanding the difference is critical for protecting children caught in the middle of high-conflict family separations. Let's start with the biggest point of confusion: the label. You may have heard of something called Parental Alienation Syndrome, or PAS. This was a term proposed decades ago to describe a child's unjustified rejection of a parent. However, the scientific and medical communities, including the American Psychiatric Association, rejected PAS as a formal diagnosis. Why? Because it framed the problem as a syndrome, or a mental disorder existing inside the child. This was seen as a flawed approach. A child rejecting a parent isn't sick. They are responding to their environment. And here's the crucial mistake that many people make. They assume that because parental alienation syndrome was rejected as a diagnosis, the entire phenomenon of parental alienation is not real. That's like saying that because chronic sadness disorder isn't in the diagnostic manual, depression doesn't exist. The rejection of a specific label doesn't negate the reality of the experience. This confusion has caused immense harm, leaving countless children and families without help because their very real suffering was dismissed over a debate about terminology. So, if it's not a syndrome, what is parental alienation? It's not a condition, it's a process. It's a set of manipulative behaviors by one parent, or sometimes another caregiver, designed to turn a child against the other parent. This process results in predictable, observable responses from the child and causes significant relational and psychological harm. Think of it as a form of emotional abuse or coercive control that unfolds within a family dynamic. It's not about a child's internal pathology. It's about external influence and manipulation. Why isn't it a syndrome? Well, for something to be a clinical syndrome, it needs a consistent cluster of symptoms, clear boundaries for diagnosis, and it has to be an internal condition within an individual. Parental alienation just doesn't fit this model. The way it looks can vary dramatically from one family to another. The harm doesn't come from a disease inside the child. It comes from the ongoing toxic relational dynamics they are trapped in. Calling it a syndrome medicalizes a complex family problem. It wrongly puts the focus on the child as the one with the disorder, which conveniently hides the responsibility of the alienating adult. It also makes it incredibly easy for critics to deny the problem exists by simply pointing out, correctly, that there is no official diagnosis. But just because it isn't a syndrome doesn't mean it isn't real. In fact, the behavioral patterns are surprisingly consistent. Across different cultures and legal systems, we see alienating parents engaging in very similar tactics. They might constantly badmouth the other parent, making them out to be dangerous, unloving, or incompetent. They might interfere with scheduled visits, phone calls, and messages, creating obstacles to the child's relationship with the other parent. They often rewrite history, creating false narratives about past events to paint the targeted parent in the worst possible light. And they frequently induce feelings of fear, guilt, or misplaced loyalty, forcing the child to choose a side. When children are exposed to this kind of behavior over time, they often start showing a predictable set of responses. You might see a child who once loved a parent suddenly and completely reject them, offering justifications that seem flimsy, irrational, or even rehearsed. They might speak about the parent using language that sounds like it came directly from an adult. Their thinking becomes very black and white. One parent is all good, the other is all bad. And they will automatically, almost reflexively, side with the favored parent in any conflict, without any guilt or ambivalence about their harsh rejection of the other. These are not normal developmental phases or simple preferences. They are red flags that something is deeply wrong in the family system. Now, it is absolutely vital to distinguish alienation from estrangement. Estrangement is when a child, often a teen or young adult, distances themselves from a parent for a valid, justifiable reason. This could be due to real abuse, neglect, or profoundly poor parenting. In cases of estrangement, the child's fear and avoidance are a healthy, protective response to actual harm. Alienation is different. The child's rejection is disproportionate to anything the targeted parent has actually done. It is induced by the manipulation of the other parent and is not based on the child's own authentic experiences. Conflating these two things is dangerous. If we mislabel a justified estrangement as alienation, we risk silencing a victim of abuse and forcing them back into a harmful situation. But if we dismiss real alienation as just a child's choice, we fail to protect a child who's being emotionally manipulated. Distinguishing between the two requires a careful, thorough investigation of the family's history and dynamics. Even without a formal diagnostic label, parental alienation is widely recognized where it matters. In the fields of psychology, social work, and family law, therapists and child development experts document its effects. Courts all over the world treat it as a serious issue of child welfare. a factual behavioral pattern that causes harm, it's considered a form of child abuse. Think about it. Many very real forms of harm aren't listed as syndromes in the DSM. Coercive control, emotional abuse, and intimidation are all real and damaging, but they aren't medical diagnoses. Their validity doesn't depend on a label. It depends on evidence and observable behavior. The harm of denying the reality of parental alienation is profound. When courts, therapists, or family members dismiss it simply because it's not a diagnosis, they are minimizing a severe form of abuse. This leads to poor, ineffective, and often damaging decisions in child protection and custody cases. The long-term psychological damage to these children is well documented. They often grow up with depression, anxiety, low self-esteem, and complex issues with trust and relationships. Many, as adults, come to realize they were manipulated and feel overwhelming guilt and grief for the lost relationship with their targeted parent. We don't need to wait for a diagnosis to acknowledge that a child is being harmed. So let's bring it all together. The term Parental Alienation Syndrome is problematic and has been rejected, but parental alienation, as a process of behavior and manipulation, is very real, observable, and deeply damaging. It's rooted in power dynamics and coercive control, not in a child's sickness. The endless debate over labels has been a destructive distraction. It has allowed critics to muddy the waters and has prevented countless children from getting the protection they deserve. The bottom line is this: children are being harmed. They're being turned into weapons in a war between their parents. Whether we call it alienation, coercive control, or emotional abuse, the name is less important than the reality. Society, and especially our family court and mental health systems, has a responsibility to recognize this harm, intervene effectively, and prioritize the well-being of the child above all else. It's time to stop arguing about the label and start focusing on the children. Thank you so much for watching and for taking the time to understand this complex issue. If this video helped clear things up for you, please give it a like and consider subscribing for more content on family dynamics and mental well-being. See you next time.